Hey, you are listening to MedikaTalks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss how to manage allergic rhinitis. Hello doctor, welcome to our podcast for patients, caregivers and healthcare professionals at MedikaTalks. Doctor, can you tell us what is allergic rhinitis?
Allergic rhinitis, also called as hay fever, is an allergic reaction to tiny particles in the air called allergens. When you breathe in allergens through your nose or mouth, your body reacts by releasing a natural chemical called histamine. Several indoor and outdoor allergens cause hay fever. Common cause includes dust mites, mold, pet dander, and pollen from trees and plants. Symptoms of hay fever include sneezing, nasal congestion, and irritation of the nose, throat, mouth, and eyes. Allergic rhinitis is not the same as infectious rhinitis, otherwise known as the common cold. Hay fever is not contagious.
Who is at risk of allergic rhinitis and how common it is?
Allergies are inherited, that is, passed down through families. You are more likely to have hay fever if you have a parent or family member with allergies. People who have asthma or eczema are more likely to develop hay fever.
What causes allergic rhinitis?
Allergic rhinitis occurs when your body's immune system reacts to an irritant in the air. The irritants, that's allergens, are so tiny that you can easily inhale them through your nose or mouth. Allergens are harmless to most people, but if you have hay fever, your immune system thinks that the allergen is introduced. The immune system tries to protect your body by releasing natural chemicals into your bloodstream. The main chemical is called histamine. It causes mucous membranes in the nose, eyes, and throat to become inflamed and itchy as they work to eject the allergen. Seasonal and perennial allergies can result from many allergens such as dust mites that live in carpets, drapes, bedding, and furniture, pollen from trees, grass, and weeds, pet dander, that's tiny flakes of dead skin, mold spores, cockroaches, including their saliva and waste. Food allergies can also cause inflammation in the nose and throat. If you think you're having an allergic reaction to something you ate, get medical help right away. Food allergies can be life-threatening.
What are the symptoms of allergic rhinitis?
Hay fever symptoms can appear throughout the year. Outdoor allergies are worse in the spring, summer, and early fall. In warm weather, weeds and flowers bloom and pollen counts are higher. Other allergies, such as those that result from pet dander and dust mites, can get worse in winter because people spend more time indoors. Symptoms of hay fever include nasal stiffness, that's congestion, sneezing and runny nose, itchy nose, throat and eyes, headaches, sinus pain and dark circles under the eyes, increased mucus in the nose and throat, fatigue and malaise, that is general feeling of discomfort, sore throat from mucus dripping down the throat, post-nasal drip, wheezing, coughing, and double breathing.
How is allergic rhinitis diagnosed?
Your healthcare provider will examine you, ask you about symptoms, and evaluate you for other conditions such as cold or asthma. To measure your antibodies to specific allergens, your provider may take a blood sample and send it to a lab for testing. This blood sample test is called immunoglobulin E test. It can detect all types of allergies, including food allergies. Your provider may recommend a skin prick test to determine what allergens are causing your symptoms.
How is allergic rhinitis treated?
Several allergy medications can improve symptoms and help you live with hay fever. These treatments come in many forms, including liquids, pills, eye drops, nasal sprays, and injections. Talk to your provider before taking any medication, especially if you are pregnant or have other health concerns. Your provider may suggest antihistamine medications which are available with a prescription over the counter. They work by blocking the histamine that your body releases during an allergic process. Antihistamine come as pills, liquids, eye drops, nasal sprays, and inhalers. They include loratadine, cetirizine, fexofenadine, levcetirizine. Antihistamines can cause drowsiness. Avoid alcohol when taking antihistamines, especially if you're going to drive. Decongestants medications relieve congestion in nose and sinuses. You can take decongestants by mouth, in pill or liquid form, or use a nasal spray. They include AD nasal spray, phenylephrine raisin spray, and physodopherin. Decongestants can increase blood pressure and cause headaches, trouble sleeping, and irritability. Nasal decongestants can be addictive if used for longer than 5 days. Be sure to talk to your provider before taking them. Corticosteroid nasal sprays and inhalers reduce inflammation and relieve symptoms of hay fever. The most common nasal sprays are Fluence, Nasacort, and Rhinocort. Side effects includes headache, nasal irritation, nosebleeds, and cough. Leukotriene inhibitors. During an allergic reaction, the body releases leukotriene, histamines, and other chemicals that cause inflammation and hay fever. Available only with a prescription, these pills block leukotrienes. The most common leukotriene inhibitors is montelukast. Some people experience changes in mood, vivid dreams, involuntary muscle movements, and skin rash when taking this medication. The other one is immunotherapy. This treatment works by helping your body learn to tolerate allergens. Your provider gives you a series of injections, that's allergy shots, with a small amount of the allergen. Every time you get a shot, your provider increases the amount of the allergen. Over time, your immune system develops immunity to the allergen and stops launching a reaction to it. Your provider might recommend immunotherapy in the form of a pill that you place under your tongue.
Can allergic rhinitis be prevented?
There is no way to prevent hay fever, but lifestyle changes can help you live with allergies. You can relieve hay fever symptoms by avoiding irritants as much as possible. To reduce symptoms, you should avoid touching your face and rubbing your eyes or nose. Close windows in your home and car during the spring, summer, and early fall when pollen counts are higher. Enclose pillows, mattresses, and box springs in dust mites cover. Keep pets off couches and beds and close doors to your bedrooms. You don't want them to enter. Use filters in your vacuum cleaner and air conditioner to reduce the amount of allergens in the air. Wash your hands often, especially after playing with pets. Wear a hat and sunglasses to protect your eyes from pollen when you are outside. Change your clothes as soon as you come indoors.
Doctor, what message would you like to give to our society?
Although hay fever doesn't cause any serious health problems, you should see your provider to rule out other conditions such as asthma. Seek care if hay fever symptoms are getting in the way of your daily life or making it hard for you to sleep. Your provider can help you identify the allergens that are causing a reaction and recommend treatments to help you feel better.
Thank you, Doctor, for being a part of MedikaTalks and sharing your insights. We're hopeful that this chat will be very insightful to our listeners.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.